Okay, so in this tutorial we're going to look at some of the features of the right side of the heart. And we'll start off with the atrium and we'll look at some of the external and internal features, and then we'll look at the right ventricle and look at some of the features internally and externally. So we'll start off by looking at the right side of the heart. So I'm assuming a bit of preliminary knowledge, so you know the basic structure of the heart in terms of the atria and ventricles, and also that you are aware of the great vessels and what these are, and sort of the basic function of the heart. So the right side of the heart receives deoxygenated blood, and it receives this blood from two great vessels. So you've got the superior vena cava and the inferior vena cava, and then you've got the coronary sinus at the back, which delivers deoxygenated blood from the walls of the heart into the right atrium. So the right atrium contracts and sends blood into the right ventricle through the right atrioventricular orifice. So what I've done here is I've just sliced a little bit of the right side of the heart away, and we can take a look inside the heart. So you can see this opening here. So this is the right atrioventricular orifice, which opens up from the atrium into the ventricle. And this is closed by the tricuspid valve when the right ventricle contracts. So the way of remembering, so you should know the basic makeup of the heart. You've got the atrioventricular valves and you've got the semilunar valves. So the atrioventricular valves, you've got the tricuspid valve on the right, and you've got the mitral valve or bicuspid valve on the left. So the way to remember that the tricuspid valve is on the right is that tri has RI in the name, so it's on the right, whereas mitral doesn't have this. So tri right, so it's the right atrioventricular valve, and this closes when the right ventricle contracts. So that's the right atrioventricular orifice opening into the right ventricle. So within the right atrium you've essentially got two spaces, and they're divided by something called the sulcus terminalis on the external surface of the heart, and internally this corresponds to the crista terminalis. So these structures separate the smooth posterior wall from the ridged muscular anterior wall. So you've got these two spaces within the right atrium. So just taking a look at the right atrium externally, you've got this notable little appendage here. This is the right atrial appendage, or the right auricle, and this little conical pouch overlaps the ascending aorta, and I'll come on to mention that in a bit. But you've also got something which I mentioned just now called the sulcus terminalis. So sulcus just means groove. So you've got this groove on the right atrium, and it's not shown on this model here, so I'll just draw it on very roughly. So you've got this vertical groove here called the sulcus terminalis, and this externally marks the two divisions of the right atrium. So what this line does is it separates the right atrial pectinate muscles from the sinus venarum. So what we're looking at here is the smooth posterior wall of the right atrium, and this smooth wall is called the sinus venarum, and the sinus venarum develops from the sinus venosus of the embryonic heart. So the sulcus terminalis externally represents the line of union between the sinus venarum and the pectinate muscle, so this rough anterior wall. So what I want to do now is we've taken this slice of the right side of the heart, and I want you to imagine that we've flapped open the anterior aspect of the right atrium. So I'm going to draw on this atrium opened up. So this is the sort of the anterior aspect of the right atrium being flapped open. So internally, corresponding to the sulcus terminalis, we've got something called the crista terminalis. So it's this smooth muscular ridge which corresponds to this line of union between the sinus venarum, the smooth posterior wall, and this muscular ridged wall. So on the muscular anterior ridged part, you've got these little muscular ridges called musculi pectinati. So I've just drawn them on here, and they're called musculi pectinati, or pectinate muscles. And these pectinate muscles extend into this right atrial appendage, or the right auricle. So you've got this smooth posterior wall which is formed from the embryonic sinus venosus, and in the adult it's known as the sinus venarum. And then you've got this line of union internally, which is called the crista terminalis, and this is a smooth muscular ridge. And then anteriorly you've got the ridged muscular wall, the pectinate muscles on this anterior wall, which extend into the right atrial appendage. So remember the sulcus terminalis, which corresponds to the crista terminalis on the external surface of the right atrium. The superior border of this sulcus actually delineates the transverse plane, or the horizontal plane, where the sinoatrial node resides in the right atrium. And the bottom of this groove, the bottom of this sulcus, the inferior boundary, marks the horizontal plane of the atrioventricular node. So I'll talk about these nodes in more detail in a tutorial on the conduction system of the heart, but it's just something to be aware of. So just coming back to this sort of sliced heart, between the right atrium and the left atrium you've got this septum called the interatrial septum. So if we rotate around the model, this wall here forms this interatrial septum. And something which isn't shown on this model is the fossa ovalis. So this, as the name suggests, is an oval-shaped depression. And it's essentially a remnant of the embryonic foramen ovale, which in the fetus allows blood to pass from the right to the left atrium. So it's actually open in the fetal heart, and you get this flow of blood from the right to the left atrium, bypassing the lungs, which aren't actually functional in the fetus, but in the adult it should be closed. So this is the fossa ovalis on the interatrial septum. And then you've obviously got the openings of these vessels. So superiorly you've got the superior vena cava opening into the right atrium, inferiorly you've got the inferior vena cava, and just medial to this vessel you've got an opening of the coronary sinus, so just here. So the coronary sinus, which drains blood from the muscular walls of the heart into the right atrium, opens just medial to the opening of the inferior vena cava. So that's some features of the right atrium to be aware of.